if you have an issue and you need an MC because mentally.
Yes, because I think to a certain extent, when you have a prolonged stress, it will lead to burnout. And when you lead to burnout, to one extent, that it can lead to mental health illnesses, such as anxiety disorder, depressions, and things like that. It's very important for us to take care of our mental health at the initial stage as well. When there's a chronic stress, stress can be a good stress, can be a bad stress. To a certain extent, when it's a prolonged stress, it will cause you to be a burnout. And when you burn out, then you get all these problems. So what do we do? So we need to really take care of our health, our mental health. First is to take a break. And second thing is to maintain your routine, because when you maintain your routine, there is some sort of sense of predictability, because for now, I think we are navigating in uncertainties. We're not sure what's happening. There are news.
Yeah, we just got
a third wave. Yeah,
right?
Exactly.
You can't go anywhere.
A lot of anxiety to it, right? Yeah. Because we don't know what's happening. So that's why we sort of like try to have a routine so that we can sort of have a sense of predictability. Another thing is self-care, managing yourselves, maintaining important, meaningful connections with people that you love, do things that you love as well, so that it sort of increase your motivations and self-worth. And these are some of the things that you can do, practical things.
There are some companies that are experimenting with, because you have medical leave, you have annual leave. They're trying to come up with something called wellness leave. What do you think of that? Is that?
I think UK had that for a long time.
Yeah.
Is it compassionate leave? Or?
No,
it's like,
it's called a wellness.
Don't do whatever. If
okay.
yoga helps you, you take it, right?
Cool.
So what do you think it should be more widely used here?
It's tricky because it involves cost, right? For workplace, it always involves cost. That's why I say a more structured wellness intervention has to be planned. Yeah. So, and this can be one of the wellness intervention at workplace, a wellness leave, right? So I would say that we may not have time to talk in length how to build that.
There's a lot that we're going to talk about here. But wouldn't it be great if we could just go off for a 2-week break just because? And it doesn't take
they can't even get a break when they come and see us now.
That's true. Baby steps, right? Let's just work on baby steps.
One at a time. Because we can't issue MC. Dr. Hanif can issue MC. We can't.
Oh, is that how it works though? So, I see.
He can issue MC.
That's an interesting one. Okay, so if you have an issue and you need an MC because mentally,
But of course, that's after thorough assessment.
No free MC.
So you can't just rock up to your office and say, "Hey, stress lah," right? No,
we're gonna go beyond that. There will be a lot of questions that we're gonna ask,
right.
and sometimes we need psychosocial investigation as well. We need to call someone that lives with you or an employer and things like that if it is being permitted by the patient. There are lots to it. Yeah.